Welcome back to Ethical Point. Let's just jump right into it today, because we've got an explainer that goes straight to the heart of one of the absolute toughest areas in both public service and corporate governance. We're unpacking a really high-stakes case study right out of the UPSC General Studies Paper 4.
That's right. And look, this isn't just some abstract philosophical debate we're having today. We're talking about a highly realistic scenario where the urgent pressure to save lives crashes headfirst into corporate greed and the frantic race for market dominance. It's basically a bioethical powder keg.
Absolutely. So, to navigate this, we're going to hit 6 key areas today: the bioethical dilemma, stakeholders and interests, evaluating unethical shortcuts, the ethical acceleration strategy, data and drug ethics, and finally, how to structure all of this to score high in UPSC. All right, so let's set the stage here. Picture this. You are Dr. Srinivasan. You're a senior scientist at a reputed biotech firm. A new, incredibly deadly viral disease is spreading rapidly across the country. Your team is working on a cure, and the pressure? It's immense. The company desperately wants that first-mover advantage to just completely capture the market. Senior team members are practically begging you to cut corners, manipulate the data to hide negative outcomes, skip informed consent entirely, and maybe even use a rival company's patented compounds. So the core question Dr. Srinivasan faces is this: do you bypass trials to supposedly save time and lives, or do you stick to the rules and risk losing the race entirely? Which brings us right to part 1. The bioethical dilemma. It's the ultimate showdown between corporate expediency and scientific integrity. The friction here is just intense. I mean, on the surface, expediency seems justified, right? People are sick, so excluding some negative data or skipping a lengthy patient consent process might seem like this sort of necessary evil to speed things up.
Well, that's exactly the trap, and it's a dangerous one. Let's pause for some conceptual clarity here. In bioethics, we rely heavily on the principles of beneficence and non-maleficence. To put it in layman's terms, beneficence means you are acting strictly in the patient's best interest. You are doing good. Non-maleficence means ensuring absolutely no harm is done. So bypassing informed consent, that strips patients of their basic rights. And manipulating data, that ensures you literally don't even know if the drug is safe. You're violating both of these foundational concepts right out of the gate.
And this brilliantly illustrates our next core concept: primum non nocere. It's a famous Latin phrase that translates directly to "first, do no harm." If Dr. Srinivasan's team overrides this principle just to secure a profit margin or hit a corporate deadline, they are creating a highly toxic environment. They aren't actually saving lives. They're just introducing an untested, potentially dangerous chemical into the public sphere. Right, that makes sense. Okay, moving to part 2. Stakeholders and their interests. Let's map out who's actually caught up in this conflict. What's really fascinating here is how deeply interconnected everyone is. We have Dr. Srinivasan right at the center, and he represents scientific integrity and responsible leadership. But look around him. You've got the biotech company's management constantly pushing for profit and rapid innovation. You've got the rival company fiercely protecting their intellectual property. And then, crucially, you have the clinical trial participants, the general public, and the regulatory authorities who actually mandate all this bioethical compliance. So the friction points become glaringly obvious when you list out their primary interests, like this. The biotech company's obsessive drive for that first-mover advantage and shareholder value clashes directly with the trial participants' absolute right to informed consent and health. The company's urge to just grab and use existing patents clashes with the rival company's intellectual property rights. And poor Dr. Srinivasan is caught right in the middle of all of this, trying to balance pure scientific integrity against aggressive management demands. Exactly. And that takes us to part 3, evaluating the unethical shortcuts. Let's look at the real price of cutting those corners. Okay, I'm going to play devil's advocate for a second here. If infringing a patent or slightly massaging the data saves, say, 6 months of R&D during a literal pandemic, doesn't the end justify the means? See, that's the short-term illusion, and it systematically falls apart when you evaluate it logically. Let's break it down. If you manipulate data, sure, you get faster approval today, but the long-term disaster? Massive loss of life from unsafe drugs, license cancellation, and actual criminal charges. If you bypass consent, yeah, you recruit faster, but you commit severe human rights violations and completely destroy public trust. If you infringe on patents, you might save R&D costs right now, but you invite massive litigation, huge legal liability, and potential bankruptcy tomorrow. These shortcuts, they lead straight off a cliff. So, the absolutely crucial point here is evaluating the core ethical framework at play. This is a classic clash. On one side, you have utilitarianism, which, in this corrupted corporate form, focuses merely on the financial gain of being the first mover. On the other side, you have rights-based ethics, which prioritizes the value of human life and preventing mortality. A supposed greater good speedrun never, ever justifies violating fundamental human rights. Wow. And looking at this comparison, it really hits you. First mover advantage versus scientific integrity. If Dr. Srinivasan's team manufactures the data just to gain an edge, it completely ceases to be science. It literally just becomes dangerous marketing disguised as medicine. Precisely. It's a terrifying thought, but there is a way forward, which brings us to part 4, the ethical acceleration strategy. Basically, how to get speed without sin. Right, because how do you realistically solve this without just sitting back and letting the virus spread? You do it by utilizing what we call ethical acceleration. Let's define this clearly for the listeners. Ethical acceleration means finding totally legitimate ways of speeding up research through smart process optimization rather than relying on unethical shortcuts. It's about being strategic and compliant, not deceitful. So, here is the actual step-by-step administrative action plan Dr. Srinivasan needs to take to maintain his fiduciary duty. Step 1, formally reject the unethical shortcuts. You have to set a hard boundary. Step 2, take that long-term disaster table we just looked at and present those terminal business risks, like a massive failed drug scandal or a bankruptcy lawsuit, directly to the board and the CEO. Speak their language. Step 3, propose rolling reviews. This means submitting real-time data to regulatory authorities for expedited emergency review without ever compromising your standards. He should also suggest adaptive trial designs, which use sound statistics to adjust trials safely on the fly. And finally, step 4. Instead of straight-up intellectual property theft, propose a patent pool or negotiate a proper licensing agreement with the rival company. That is such a brilliant, practical way forward. It solves the problem without breaking the law. Which brings us to part 5, data and drug ethics and how they actually save humanity at large. But, in the heat of a pandemic, someone might still ask, why can't these strict ethical frameworks just be treated as a luxury we can't afford right now?
Because data ethics isn't a luxury. It acts as an absolute shield. Honest data collection ensures veracity. Just think about the stakes for a second. If Dr. Srinivasan's team hides even a 10% risk of heart failure in their data, mass distribution of that drug could literally kill more people than the virus itself. Rigorous data ethics is the only thing that prevents these iatrogenic, which basically means doctor-induced, catastrophes. Plus, in today's social media age, it's your only defense against deadly misinformation.
And while data ethics is a shield, drug ethics acts as a compass. It centers entirely on good clinical practice. If you don't prioritize patient autonomy through informed consent, and if you don't ensure fair, equitable treatment, you destroy public trust overnight.
Exactly. And without public trust, people will simply refuse the treatment when it comes out, allowing the virus to just keep spreading anyway. So the shortcuts totally defeat their own purpose.
Hit the nail on the head, which leads us perfectly into our final section, scoring high in UPSC. Let's translate all this theory into marks. Breaking the fourth wall here for our listeners studying for the exam, how should an aspiring civil servant actually format all of this into a high-scoring 20-mark answer?
You need a highly structured framework. Don't just ramble. Start your introduction with pure conceptual clarity. Explicitly define beneficence, non-maleficence, and primum non nocere to show the examiner you understand the bioethical bedrock. Then, in body paragraph 1, succinctly map out those stakeholders and their conflicting interests we talked about. In body 2, logically evaluate the options, making sure to highlight how short-term corporate expediency always leads to long-term legal and public health disasters. Then for your way forward, don't just write, be ethical. Give a real administrative solution. Use the term ethical acceleration and list out actionable steps like rolling reviews and patent pools.
Finally, for your conclusion, you want to leave a lasting impression. Link scientific integrity directly to public trust. A really powerful quote you can use as your closing statement is right here. Scientific excellence must never come at the cost of ethical integrity. Dropping that in demonstrates to the examiner that you possess strong, unshakable administrative values even in the middle of a crisis. That is incredibly helpful for anyone facing this kind of case study. So to wrap up today's explainer, we want to leave you with a final, provocative thought to chew on. If the data is manufactured to win a corporate race, Is it even science anymore? Or is it just marketing disguised as medicine for profit?
It's a huge question, and it's one every single public servant, corporate leader, and scientist has to ask themselves when they're tempted by those shortcuts. Thank you so much for joining us on this deep dive. Keep questioning, keep learning, and we'll see you on the next explainer right here at Ethical Point.